At Mount Sinai Brooklyn, what is your #1 challenge right now in the emergency room?
So I'd say, good morning. Thank you very much for this opportunity, by the way. It's in the emergency room and it's in the hospital. We are seeing a real surge in cases, which is obvious in the numbers that you see from around the area, both to the emergency room and then, through their inpatients into the hospital. So patients are coming into the emergency department, getting admitted to the hospital, and they're not moving forward. Most hospitals work on models where you admit a certain number of patients a day, and then you normally would discharge a certain number of patients a day. What we're seeing with these patients, the ones that are sick enough to require admission, probably just because of the basic virology and the inflammatory response that comes with it, these patients are not improving and they're not being discharged. So my hospital, all the hospitals in the system are starting to back up.
Dr. Shearer, is there a way for anyone to delineate between this terrible virus and any other normal flu or bacterial infection? Is there a way to nuance it before they call someone like you at your hospital?
There is, and most of this can be done over the phone or telehealth visits. And so I would encourage people, if you go to any of the, we say within New York City, any of the major hospital systems websites, they all have telehealth options available to you. So you can, with a few clicks, you can register and you can be seen by a physician on that telehealth site. They can differentiate. In reality, if you have symptoms of fever, cough, body aches, you are almost definitely a COVID-19 patient. So there's no testing that needs to be done. Testing can certainly help delineate a bit, but at this point it doesn't need to be done. We know what the epidemiology is in our area, and essentially the virus is rampant. So if you have symptoms, you're positive. Vast majority of patients do not need to be hospitalized, and you can manage all the information you need to know about this through a telehealth visit.
Dr. Shearer, what do we know about the number of cases that are mild compared to the ones that are critical and the ones that are severe? I know that I was reading this morning, there's a Chinese study suggesting that 81% of confirmed cases are mild, 14% are severe, 4.7% are critical. Does that sound right, or are you looking at other numbers, or is it too soon to tell?
No, that sounds perfectly correct. So about 80% of patients who have COVID-19 who would be tested positive are mild and can be managed in an outpatient setting. And then you look at that other 20% that needs to be hospitalized, and a good number of those need to be hospitalized in a medical unit to receive supplemental oxygen, for example, and a smaller percentage, somewhere between 2 to 5%, will need to be admitted to intensive care units. But again, as we're seeing in my hospital and across the system, these patients are sick, so they require supportive therapy, but they're not improving. They're not improving to a point after 7 days where you would normally expect patients who would to be able to be fit for discharge, either to a nursing facility or to home with some home care services. They're not improving in the way that we normally would expect patients to, leading to a real backup in the system.
Doctor, can people catch it more than once, and could warming weather actually help fight COVID-19?
Yeah, I think the medical science is still indeterminate on that. Certainly people do develop an antibody response after they've recovered, and so that should be protective. But certainly we've heard stories of people getting reinfected. But I think the vast majority of people will have developed some degree of immunity. So that's at least one sort of, I would say, glimmer of light for a lot of us.